Can the sweat test diagnose cystic fibrosis in adults? Imagine a simple test that can reveal a hidden genetic condition that affects the lungs and digestive system. That test is called the sweat chloride test, and it has been a cornerstone in diagnosing cystic fibrosis for decades. Cystic fibrosis is caused by mutations in the CFTR gene, which disrupts how chloride ions move in and out of cells. This disruption leads to higher salt levels in sweat, making the sweat chloride test a reliable way to detect the disease. This test is suitable for people of all ages, including adults. While many cases are diagnosed early in childhood thanks to newborn screening programs, some adults might not have been diagnosed earlier because their symptoms were mild or atypical. For these individuals, the sweat test can be a crucial part of the diagnostic process if they show signs such as persistent lung infections, difficulty breathing, or digestive issues. The procedure is straightforward and painless. A healthcare professional applies a small amount of pilocarpine, a chemical that stimulates sweat production, to the skin on the forearm or thigh. A gentle electrical current then encourages the sweat glands to produce sweat. The sweat is collected on a piece of filter paper or gauze, or in a small plastic coil, and sent to a laboratory for analysis. If the chloride concentration in the sweat exceeds the normal range, it strongly indicates cystic fibrosis, especially when combined with clinical symptoms or family history. It is important to remember that while the sweat test is highly reliable, it is not infallible. Some individuals with cystic fibrosis may have borderline or even normal sweat chloride levels, especially in milder or atypical cases. Conversely, elevated sweat chloride can sometimes occur in other conditions, although this is rare. Because of this, healthcare providers often recommend genetic testing alongside the sweat test. Genetic testing can identify mutations in the CFTR gene, providing additional confirmation and clarity, especially when sweat test results are inconclusive. For adults suspected of having cystic fibrosis, the sweat chloride test remains a key initial step. If the results are positive or borderline, further assessments like genetic testing and a thorough review of symptoms are usually advised. Early and accurate diagnosis is vital because it allows for timely management and treatment, which can greatly improve quality of life and health outcomes. In summary, the sweat chloride test can indeed diagnose cystic fibrosis in adults. It is a safe, accessible, and well-established diagnostic tool supported by decades of clinical use. However, it should always be interpreted within the context of the individual's overall health, family history, and additional testing results. Anyone concerned about cystic fibrosis should consult a healthcare professional to discuss their symptoms and determine the most appropriate testing and next steps.